So it's getting into the colder seasons. So a lot of people are starting to get upper respiratory tract infections, colds, flus, viruses, all that kind of stuff. This will lead to a buildup of phlegm in their lungs. So this is a beautiful technique that we use in hospitals, and I prescribe it to patients with these issues that helps to move all the phlegm that's built up in their lungs and to expel it out, or they can swallow it down. So we call this technique the huff. The huff is similar to a cough, but you keep your throat open, okay? So it's a little bit more efficient than doing coughs and doing like hacks to try to get phlegm up. And let's go through it right now. So there are different volumes to doing a huff, okay? There's a low volume huff, a medium volume huff, and a high volume huff. So low volume huff is just to get the air down underneath all that build up and to move it closer to the surface here. So the best way we teach it is to think about fogging up a mirror. So you're going to take a deep breath in, slow and low, and then so as you breathe out and breathe in, it's going to move all of the phlegm out here closer to the airways. Next one is a mid-volume huff. So a little bit more force behind it. This is to get the phlegm from here up to the throat. So again, deep breath in and a little bit more force behind it, and that's to push it up here. So if you do have a buildup of phlegm or whatnot, you actually feel and hear the gargling of the phlegm building up in their throat, and this will lead to the next session. So this is the high volume huff. So at the end, very big deep breath in with all the force similar to a cough. You're going to keep your throat open and force it out. So deep breath in, throat open, and this will force all of the phlegm that's built up. So I personally do this every morning as I'm brushing my teeth just to clear up my lungs. It works really well when I'm sick. So I've been sick a couple months ago, and it just cleared up all the phlegm. Make sure you have something nearby. So in the practice, you'll use tissue to catch all the phlegm. When I was working in hospitals, they would use cups because there'd be that much phlegm, it just built up in the cup. It's kind of gross. But at home, in the shower would be a great place because the steam will actually help to loosen up the phlegm to make it flow easier. Otherwise, into the sink is perfectly fine. In terms of sets and reps, you want to do about 2 low volume huffs, take a resting break, 2 mid volume huffs, take a rest, and then 2 high volume huffs, and then take a rest. So when you take a rest, you just slow, relaxed breathing. Bring your head back if you're a bit lightheaded or dizzy, but if you do get too breathless or lightheaded, just stop the technique straight away.